Hello and welcome. Today, we're diving into the itchy, watery world of allergic conjunctivitis. If your eyes have ever felt like they're under attack from pollen, pet dander, or other irritants, then you've probably experienced this common condition. Join us as we explore what causes it, how it affects your eyes, and what you can do to find relief. So, what exactly triggers allergic conjunctivitis? The main culprits are allergens, substances that are typically harmless but provoke an immune response in sensitive individuals. Common airborne allergens like pollen from trees, grasses, and weeds are major offenders, especially during allergy seasons. Other potential triggers include dust mites, pet dander, tiny flakes of skin shed by animals, mold spores, and even certain cosmetic ingredients or contact lens solutions. When these allergens come into contact with the conjunctiva, the clear membrane covering the white part of your eye, and the inner surface of your eyelids, the allergic reaction begins. Now, let's delve into the how. Allergic conjunctivitis is fundamentally an immune system overreaction. When an allergen enters the eye, it's recognized by specialized immune cells called mast cells, which are abundant in the conjunctiva. These mast cells then release histamine and other inflammatory mediators. Histamine is the star player, causing blood vessels in the conjunctiva to dilate and become leaky. This leads to redness, swelling, and increased permeability, allowing fluid to leak into the surrounding tissues, resulting in the characteristic itching, tearing, and discomfort associated with allergic conjunctivitis. Other inflammatory mediators contribute to the inflammation and irritation, amplifying the allergic response. Allergic conjunctivitis is a widespread condition affecting a significant portion of the population, particularly those with other allergic conditions like allergic rhinitis, hay fever, or asthma. The prevalence varies depending on geographical location and the time of year, with higher rates during peak pollen seasons. Children and young adults are often more susceptible, but anyone can develop allergic conjunctivitis at any age. Understanding its prevalence underscores the importance of recognizing the symptoms and seeking appropriate treatment. The signs and symptoms of allergic conjunctivitis are usually quite characteristic. The hallmark symptom is intense itching, often described as a relentless urge to rub the eyes. Redness is another common feature, caused by the dilated blood vessels in the conjunctiva. Watery discharge is also typical, although the discharge is usually clear and thin, unlike the thick, purulent discharge seen in bacterial conjunctivitis. Swelling of the eyelids, also known as chemosis, can also occur. In some cases, people may experience a burning or gritty sensation in their eyes, and increased sensitivity to light of photophobia. Symptoms are often bilateral, affecting both eyes, although one eye may be more severely affected than the other. Diagnosing allergic conjunctivitis usually involves a thorough medical history and physical examination. Your doctor will ask about your symptoms, including their onset, duration, and any potential triggers. They'll also inquire about any history of allergies, asthma, or eczema. A slit lamp examination, which uses a special microscope to examine the eye, can help to visualize the conjunctiva and rule out other possible causes of your symptoms. In some cases, allergy testing, such as skin prick tests or blood tests, may be recommended to identify the specific allergens triggering the reaction. However, the diagnosis is often based on the clinical presentation and response to treatment. While the overall mechanism is similar, allergic conjunctivitis can manifest in different forms. Seasonal allergic conjunctivitis, SAC, is the most common type, triggered by seasonal allergens like pollen. Perennial allergic conjunctivitis, PAC, on the other hand, occurs year-round, often caused by indoor allergens like dust mites, pet dander, and mold. Vernal keratoconjunctivitis and VC and atopic keratoconjunctivitis AKC are more severe and chronic forms, often associated with other allergic conditions like eczema. These types can cause significant corneal damage if left untreated. Fortunately, there are several effective treatment options available for allergic conjunctivitis. The first line of defense is often avoiding the allergen if possible. Over-the-counter artificial tears can help to lubricate the eyes and wash away allergens. Cold compresses can also provide soothing relief. For more persistent symptoms, antihistamine eye drops can help to block the effects of histamine. Mast cell stabilizer eye drops prevent the release of histamine and other inflammatory mediators. In severe cases, corticosteroid eye drops may be prescribed to reduce inflammation, but these should be used with caution due to potential side effects. Oral antihistamines can also be helpful in controlling systemic allergy symptoms. And if specific allergies are identified, allergy shots immunotherapy may be considered. The best way to manage allergic conjunctivitis is often through prevention. Identify and avoid your allergy triggers whenever possible. During pollen season, keep windows closed and use air conditioning. Wear sunglasses outdoors to protect your eyes from pollen. Wash your hands frequently and avoid rubbing your eyes. If you wear contact lenses, clean them regularly and consider using daily disposables. Using allergen-reducing bedding and air purifiers can also help to reduce your exposure to indoor allergens. The prognosis for allergic conjunctivitis is generally good. Most people experience relief from their symptoms with appropriate treatment and allergen avoidance. However, symptoms can recur, especially during allergy seasons. Chronic forms like vernal and atopic conjunctivitis require ongoing management to prevent corneal damage. Recent research has focused on developing newer, more effective medications with fewer side effects. For instance, some studies are exploring the potential of topical calcineurin inhibitors for managing severe allergic conjunctivitis. As our understanding of the immune mechanisms underlying allergic conjunctivitis improves, we can expect to see further advances in diagnosis and treatment. Thank you for joining us today. Remember to consult with your doctor for personalized advice and treatment options.